Hello, good day to all of you. This is Dr. Kingsley Oturu, and I'm streaming from Edinburgh, Scotland. I'm a researcher with Strathclyde University with a remanufacturing project, and I'm excited for the privilege of partaking in this conference. I would like to thank the organizers. I would like to thank Professor Noordin Shokirat and all the other organizers. I want to use this opportunity to thank Dr. Ijoma Winifred from Strathclyde University, Professor Wale Koka, Dr. Archie Chubeze. So thank you all of you for all your contributions and support. Thanks again for inviting me for this conference. I'm going to be talking about COVID-19 and the importance of international joint projects, using remanufacturing in Nigeria as a case study. So I'm going to share my screen now. Okay. Okay, so as I said, Dr. Kingsley Oturu, I'm going to be talking on COVID-19 and the importance of international joint projects using remanufacturing in Nigeria as a case study. In terms of my background, I'm a medical doctor, public health specialist, and a researcher. And this presentation is based on information based on what we know as of August 2020. It draws on expertise and experience working in the HIV pandemic field. Coronavirus is a new disease and we are constantly learning about it. Knowledge is constantly evolving and expanding. And so the knowledge of what we know today may be different in some few weeks or months' time. And in avoidance of doubt, always follow your local guidance wherever you are. So COVID-19 is a global pandemic. In the UK, it's about 46,364 deaths, with 188 confirmed cases early August. Globally, 18,614,177 confirmed cases, with 702,642 reported by the WHO. And the recent findings suggest that Africans, Asians, and ethnic minorities appear to have affected more by COVID-19 in terms of risk of being infected and then the impact following infection. So what is coronavirus infection? Is the name corona is gotten from the Latin corona, which means a crown based on the shape of the virus. And there are different kinds of coronaviruses. It's a large family of viruses. You have the common cold, the Middle East respiratory syndrome, severe respiratory syndrome, SARS, which we had some years ago. So these are all in the same family of coronavirus infection. It's a novel virus showing that it's new, was newly identified in December 2019. So the CO there stands for corona, VI for virus, and then D, disease. So we add that together, coronavirus disease, COVID-19. So that's how you got the name COVID. Countries advised to follow international health regulations by the WHO, but these are usually tailored, to fit your local guidance. So where does COVID-19 come from? There's a possible theory about a zoonosis from Huanan seafood and wet animal wholesale market in Wuhan, China. There's a thought that it may have come primarily from bats and then going through the pangolin, before going to human beings. Just like, civet cats with SARS, it was thought that civet cats were involved in the transmission of SARS in 2002, and then dromedary camels, in Saudi Arabia for MERS in 2012. So there are several known coronaviruses circulating in animals that are yet to infect humans. And so that's why surveillance is important. And there's a risk that a new virus can come every couple of years. And so with globalization, it's very important that knowledge is shared and that international collaboration is fostered. So I did some analysis looking at COVID-19 and HIV. And there are some similarities and differences. For example, you have the WHO international guidelines versus local guidelines, and we are seeing that gradual change. So you have the global WHO guidelines on how to deal with COVID-19, and different countries are having their own local guidelines, like the USA, tailoring more towards their own local guidelines. And then you have the issue of stigma. Stigma is a big problem with HIV. Doesn't appear to be that much of a problem with COVID, but still with the social distancing, you find that people who are infected, people wouldn't, come in close contact with them. Both COVID-19 and HIV are RNA viruses that use the body to produce more viruses. Whereas in HIV, it goes through the tissues generally. With COVID-19, it tends to focus on the respiratory cells, the alveoli of the lungs. Both have asymptomatic periods. However, for COVID-19, it's acute. Within a few days, you go through the incubation period, the asymptomatic period, to the period when people start having symptoms. Whereas in HIV, it's more chronic. COVID-19 spreads, through sneezing, coughing, touching fomites, infected surfaces, hands that are infected, whereas HIV is through, blood transfusion, intimate contact, sexual intercourse. So those are the main differences. So like I say, it has short incubation period. COVID-19 attacks the alveoli cells in the lungs, while HIV has a longer incubation period and affects basically all the cells in the body. So the pathogenesis for COVID, you have the asymptomatic phase, which normally lasts about 1 to 2 days of infection. And then there's a stage 2 where there's upper airway and conducting airway response within the next few days. And then stage 3, you get hypoxia, ground glass infiltrates, and progression to acute respiratory distress syndrome. So what are the signs and symptoms? So you have things like fever, chills, cough, shortness of breath, difficulty in breathing, tiredness, fatigue, muscle aches, headache, loss of smell, sore throat, congestion or running nose, nausea or vomiting, and diarrhea. But the main symptoms are mainly fever, cough, and difficulty in breathing. Some of the complications include pneumonia, severe acute respiratory distress syndrome, kidney failure, thromboembolism, septic shock, pancreatic failure, and ultimately death. So it spreads from, how does it spread? From person to person, usually after close contact, from an infected patient, for example, in a household, workplace, or through a healthcare center, from droplets from cough or sneezing, touching infected hands, surface, mouth, or nostrils. So how do we prevent it? Reduce exposure. And that's all over the world. We had the lockdown, stay home, work and study from home where possible, because, the only way someone can get infected is if they're exposed to the virus. So theoretically, if somebody is at home and doesn't have access to exposure to the virus, that reduces the risk of getting infected. Basically, basic hand hygiene, washing your hands, because you may go out, touch an infected surface, but if you wash your hands, when you get home, then, it reduces the risk. Maintain respiratory hygiene, cover nose and mouth, with a tissue when coughing, and put it in the bin. Now there's face masks are being advocated around the world. avoid close contact with someone coughing or sneezing. So if you see someone, coughing or sneezing, try not to get close to them. Social distancing, keep the 2 meters apart from people. Safe food practices, and then also very important to clean the environment and surfaces with disinfectants. People can get so engrossed in washing hands that they forget about normal things like making sure that the house is clean, disinfected, surfaces are clean. So all those things will reduce the risk of infection. Vaccination may also help. No vaccine at the moment, may take months or years for a new vaccine to be developed and tested before administered to humans, and there was a belief that, once somebody is infected, they receive immunity for life, but the World Health Organization is suggesting that that may not necessarily be the case. So the fact that somebody has been infected with COVID-19 and recovered doesn't mean that they are, completely immune. It may provide some protection for some weeks, months, it's still being studied, but it doesn't necessarily offer immunity. So there's some, myths, some people feel like, go on social media, you hear things like garlic, ginger, saunas, inhaling heat from pots, that these can protect against coronavirus infection. There's no scientific evidence to support these things. It's good to have a healthy diet, take garlic, ginger, have your sauna if you want to do that as part of a healthy lifestyle, but don't use those things to replace local guidelines, depending on the curve where you are. So stay at home where possible, wash hands, keep social distancing as much as possible, depending on the stage of the pandemic where you are. Treatment, there's no specific treatment. Therapy is usually supportive based on the signs and symptoms, that the virus manifests with. Supportive care can be effective, early supportive care, and then ventilators are being used in end-stage respiratory diseases, cases. So remanufacturing is something that has a role to play in combating COVID-19. For example, one of the things that we've noticed that there's a large turnover of personal protective equipment, especially in the late stage of the disease. So hospitals, care homes are using a lot of personal protective equipment. So these are being discarded, daily in the hundreds of thousands. So are there ways in which this personal protective equipment could be remanufactured in a secure manner, in a sterile manner? Then you have the use of ventilators in managing COVID-19, and the anesthetic machines for advanced respiratory support, such as mechanical ventilation. So there are a lot of international collaborations, between the UK and Nigeria, and one of them is one being fostered, and supported by the Royal Society between Strathclyde University and University of Ibadan in Nigeria, looking at how medical equipment could be remanufactured. And part of the areas that are being looked into are things like ventilators and also anesthetic machines. So what exactly is remanufacture? It's a process of returning a used product to at least the original manufacturer's original performance specification from the customer's perspective, giving the resultant product a warranty that's at least equal to that of a newly manufactured equivalent. So in other words, the equipment is being brought back to the original performance specification, and given the warranty of a new product. And, with remanufacturing, the warranty could even exceed that of a newly manufactured product because more advanced parts may be included in the process of remanufacturing. So there's a difference between recycling, remanufacturing, and reconditioning, as you can see in the chart below. Remanufacturing is not just involved in repairing and reconditioning a product for use, but ensuring that that product is up to the original manufacturer's warranty. And that will help to limit landfill waste, energy waste, and wasting of resources. So you have different benefits from remanufacturing: economic benefits, environmental benefits, societal benefits, even to the supplier, and then also to the patient as well. So what are the advantages of international collaboration, joint projects? First, you have expertise transfer. People can be able to learn from, more advanced countries. There's skill and knowledge transfer, resources that may not be available in, for example, the developing world could be available in the Western world and could be transferred. Shared learning, what works in the management of COVID-19, in the management of different diseases, cultural exchange, cross-fertilization of ideas from different cultures, harnessing and sharing of resources, and then also better outcome for patients. Because when we're able to share ideas, share knowledge, share expertise, then we believe there will be better outcomes for patients. Capacity building, building the capacity of healthcare workers, globally, and also policy development and learning. So the manufacture of health equipment, for example, like what is being done with the project I talked about, with anesthetic machines. There's cost savings, reduction of waste, improvement of technology, and then the capacity to adapt parts to fit the local situation. There may be certain parts and equipment that may be more useful in a temperate environment than in a humid environment, for example, or in a hot environment, like in Africa. Then capacity building, there are opportunities to build the capacity of local human resource on the ground, and also improvement of benefits for the patient, because at the end of the day, is what is benefiting the patient. It's all about the patient. So in conclusion, COVID-19 is a crisis that has widespread global impact. International collaboration and projects are important in sharing and learning resources and expertise to combat the pandemic and other challenges. Remanufacturing from an international collaborative perspective could be one of those strategies harnessed in controlling the pandemic. So thank you so much. Keep healthy, keep safe. So we acknowledge Royal Society and the Faculty of Engineering, University of Strathclyde, the Remanufacturing Project team. And these are references and bibliography if you want more reading. Thank you so much. It's nice meeting all of you, and keep healthy and keep safe. Bye-bye. Thank you so much. Bye.